Stand for the pledge. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Adam, you want to go ahead with your report?
Sure. December was another busy month. COVID keeps us all things busy, unfortunately. So total 911 for the month was 234. When you take in our mobile integrated health, our community visits, busiest month to record, which is 401, which averages out to basically 15 a day. So the crews were staying pretty hopping the whole time. Times right there, we're still at 0.81 for dispatch en route to arrive on scene is 5.71, which is a lot better than industry average, so I'm pretty happy with that. The only time I'm wanting the crews to work on is their back in service time, so the time they drop off the patient, the time they actually get back in service. We did have more out of town trips this time, so taking patients to Union Regional, there's a couple Carls in there. So when you throw in those outliers, that's kind of what extends that time out. When we transport to Paris, their dispatch, or their at hospital to back in service time is usually around 10 minutes, but when you take into a Carl trip, when you're dropping off, it's going to be an hour minimum, at least by the time you drop off and the time you get back in service. So I think that's what's pushing that time out. So some of it I can work on the crew a little bit with, others it's just outside our control. You can read down the rest of the list there. Our mobile integrated health, so when we go out and check on these patients in their homes, in November we did 88, and December we did 167. So those numbers are just blowing up. Did get approval about a month ago. That is going to now become its own service line. So EMS will still be helping with that, but we'll starting on the 23rd of this month, 24th technically, that will have a full-time crew member dedicated to that service line. A lot of you know Cody Moko. He is taking on that program, so he'll be the full-time provider for that mobile integrated health program.
So currently when you do that, it's an ambulance crew going out in an ambulance to check on it, because
Correct.
from time to time I see different places, them stopping at a house
Yep.
and no lights or anything, so I figure that's what they're doing.
Most of the time that is the
Right.
case.
And, well, he won't be using an ambulance, will he? I assume?
He will still on occasion.
Okay.
We are working in the process of getting that service line their own vehicle.
Yeah,
But right now, they do need cardiac monitor and some meds and stuff like that. So until we can get all the,
yeah,
I don't want to pull equipment off an ambulance to do that.
right,
So right now, we do have two spare ambulances that we're not using.
I see.
So it's just easier for them to take that and go out and do those. That way, if they get on scene and realize, hey, this patient needs more care than what one person can provide, they can already go ahead and get things going till an actual transport crew can get there as well. So not a bad idea to have,
Right.
but we are, like I said, that service line is starting, so kind of a developing process.
Right.
I couldn't get this to print on you guys' report, but I ran totals and averages for the entire year. So total 911s for 2021 was 2,119, averaging 5.7 just 911s a day. Average dispatch en route is 0.85 minutes, which for the year I'm pretty happy with. Mobile integrated health visits for the year was 522. 380 of those were in the last October, November, December. So just in the past 3 months, that program has really gotten super busy. 2022, our total call volume between everything was 2,667. For 2021, not including our MIHs, was 2,979, so about 300 higher. Then when you add in MIHs, our total for 2021 was 3,509. So almost a full 1,000 higher than 2020. Any questions on any of the numbers?
Very busy.
Pretty busy.
When most of the time on your helicopters, they come out of Terre Haute.
No, I would say the majority of the time they use air evac, whether that comes out of Brazil or Mattoon. But we've been so busy lately, we've been using air evac, Air Life out of Champaign. We had Arch 3 out of Effingham come up the other night. I think last week alone we had at least 8 aircraft in a week.
I know they fly over my house all the time.
So we don't have a contract per se
Right.
with any service. There are a lot of air evac members in Edgar County, so we try to, if we know they're an air evac member, we'll try to use that service. What people don't really know is other services outside of air evac have a non-balanced bill policy, so you don't really need a membership. It's just one of those things air evac sells. We're always going to do what's best for the patient. If the patient requests a specific helicopter, we'll do everything we can to make sure they get that one.
Mhm.
But they're just as busy as we are right now, so we've had some instances where we had air evac out of Effingham come up, and they were the third closest air evac just because the other two were already busy.
Now, like out of Brazil, how many helicopters they have?
Just one.
Just one?
One per base.
Normally, most of them just have one.
Yeah.
You know.
We're pretty lucky geographically
Mm-hmm.
that we have 1, 2, 3, 4, 5, 6 helicopters relatively close to us.
Mm-hmm. What's most of them transporting when you're is it? I mean, what's the situation? Is
It could be stroke, cardiac. A lot of the stuff we've done lately is respiratory failure, whether that be COVID or non-COVID related. There has been a lot of COVID-related respiratory failure. So one thing we're running into a lot is all the closer hospitals are full, so we're having to transport patients further and further away.
Mm-hmm.
If the patient is on super high flow oxygen, so like if they're on CPAP, that uses so much oxygen. If we're going 4 hours away, our trucks just can't provide. I mean, there's no ambulance can provide that kind of flow rate.
Mm-hmm.
So if we fly them, we can kind of cut that time essentially in half.
Mm-hmm.
Basically, any transport we do, I make sure, I've got an oxygen calculation tool, and I make sure no matter where we're going, we have a minimum of 30 minutes extra than what we need just in case
Mm-hmm.
there is something, because I never want to get in a situation where they get stuck in traffic and run out of oxygen.
Right.
That's bad for everybody.
Mm-hmm.
So there is lots of different we'll never fly a patient just
Right.
for something simple. I mean,
Exactly.
those are reserved for the sick patients,
Mm-hmm.
whether it be medical or trauma.
So I assume you're pretty well filled up out here too.
Right now, no. It comes in waves.
Right.
Say there's some days where we'll be sitting at 25, and there's days like today where we've got some room, but
Mm-hmm.
I mean, that changes by the hour, honestly.
I noticed in Indiana, there's several hospitals that are utilizing National Guard to take care of stuff. I know when Brad, he's over in Indianapolis for a month, and there was National Guard people in there.
We're lucky enough we're not to that point yet, but I'm not saying anything's possible.
I didn't know whether Illinois was utilizing that.
Not that I've heard.
Yeah.
I know, like I said, I know Indiana facilities are. I think Union's actually using some National Guard as well, but
Mhm.
to my knowledge, Illinois hasn't activated that yet.
Yeah.
Some of our big ticket items I just want to touch base on this year. We did put the automatic CPR devices on every truck. We've got top of the line ventilators on every truck, and we do have body armor now for every employee. So that represents a substantial investment for the community, but we will always provide top line equipment. That is one thing that I said when I took over, that we will have the best things possible for our crew and our community, and the hospital has backed me on that. So I've already spent about $120,000 last week on additional / new equipment for us as well. So we are very fortunate to what we have, and like I said, we will always provide the best possible we can. You guys have any questions for me on anything throughout the year or coming 2022? Ambulances continue to be hard to come by, but luckily I've talked to one of my ambulance manufacturers, instead of buying a new ambulance this year, I'm gonna send one of the old ones down to the factory. I'm gonna do what they call a remount, so our oldest unit, they basically pick the box up off of it, put a new chassis underneath it, and it's all new electrical throughout. Basically all new guts with the same box. The box is completely solid, no issues at all, but that'll go down in June and come back in September, so we'll have essentially a new ambulance in September.
Engine and everything?
Complete chassis.
That's interesting.
It saves about $100,000. A new ambulance right now, you're pushing about 300,000. Doing a remount costs anywhere between 150 and 200. I was talking to my Braun dealer, so our new ambulance is a Braun. I was talking to him the other day, and if I would order an ambulance now, they're not even guaranteeing delivery until March of 2024. That's if I order it today.
Any other questions of Adam? Thanks, Adam. Andy?
No, nothing.
Nothing.
It was over Christmas holiday. Nothing broke, so I don't have anything to come on good news talking about. Maybe Wednesday.
I noticed on the jail inspection, did everybody get a copy of that jail inspection thing, and look at it?
I looked on the computer.
Yeah, I was looking at it, and of course there was zero non-compliance, which is good. I think that was last year, or 2021 inspection. The 2020 inspection was, I think there was 2 non-compliance, so it's vast improvement over years in the past. You know, so thanks to the sheriff and Jay for getting things turned around. And the fact to have no non-compliance, that's pretty good. But anyway, in that they mentioned about the new boiler on there. Another thing they mentioned, you know, adding the third, I think the third AED or something. I don't remember exactly what it was, but something, it was mentioned about the AEDs that we provided, you know, to all the county offices, you know, that was added to the jail. So I was well pleased with that inspection report. So, Russ, I have anything? I don't have anything.
Good.
Lisa?
Russ and Derek and I met earlier last week, to do a final run through of the solar ordinance, taking into consideration some of Illinois Farm Bureau legal team's comments and made some revisions. And so Jeff has that, and he's going to forward it to Mark. So the good thing is the state of Illinois also has a contract for solar, commercial solar farms. So ours was not having to go from scratch the way the wind one was. So we're still on track. Hopefully we'll have the document back from Mark to discuss at our next study session, so that we'll be able to have our hearing as scheduled for the first meeting in February. And that's all I have.
Augie, did you have anything?
I don't think so.
Okay,
Um,
all right. Go ahead.
Sorry, Augie, what about HR, Bellwether?
yeah, just trying to figure out a time. So I'm going to try to pin him down. See if we can't get something going in February. The Bellwether does a lot of the ARPA money, the millions of dollars that all the counties get for COVID, and there are guidelines on how you can use that, what you can spend it on, and they are swamped with helping counties figure out plan how to use their funds. So I know that's a big holdup right now.
The agenda, there's the one highway resolution, annual report from HRC, resolution to expend $135,000 of COVID funds. Do you know
Yeah.
what that is?
Um,
What it's for?
off the top of my head, no.
Okay.
Josh filled that, made up that resolution.
So, is it on the resolution what it's for, or if not, we need to find out where it's going, what it's going for? If you can find out by Wednesday,
Yeah,
so we'll know.
we've got the resolution right here. Reimburse the general fund.
It's probably on what we've done in the past for the, if someone's sick and stuff
Yeah,
like
it-
that.
Yeah, when I look back here, yeah, here's some payroll numbers. That's
Yeah,
what it is.
yeah,
It's reimbursement for payroll
Right.
during COVID.
Yeah, okay.
Yep, yep.
And another one is to execute a lease to Fruin and Garst for the public defender. Where the public defender's office is going to be in Fruin, and Cash's law office. Utilize that. Because at one time, we talked about trying to find a building to rent or something around the square. And I know when me and Jeff initially talked to Judge Garst, I mentioned the possibility of looking at Fruin and Garst, and evidently they got that worked out. So that's where the new public defender's office is going to be, over there. And then the jail inspection report,
What's number 12 on there?
Scrivener's error for study session.
Yeah, thank you for bringing that up. When we passed the study session calendar, along with the county board and the holidays and all that, I put together the study session list first, and then there was a lot of discussion on holidays and whatnot, and gosh, there were 2 dates on there. June 20th, which is federal holiday for Juneteenth, which is a Monday, and then Christmas. Christmas Day is Sunday, so Monday they're observing the holiday on that Monday. So we're just going to meet on Tuesday, after those holidays. So I wanted to update that so there's no misunderstanding when we meet. So that's all that is. So.
Anything else from anybody? Okay. Motion to adjourn. Second. All those in favor?
Aye.
We're adjourned. Thank you.
Yeah, Jeff down here is, what,